Hi, Nurse Sherry here, and today we're going to be going over safe and effective blood draw. The first thing you're going to do is wash your hands. Then you're going to gather your supplies. You will need 1 pair of gloves, a tourniquet, 2 cotton balls, 2 alcohol wipes, 2 tubes, and 2 needles. I have one of 2 different kinds there, and I like to have 2 of everything just in case you need it. Okay, so the first thing we're going to do is go ahead and apply the tourniquet and see which vein looks good for us to draw. The tourniquet should be applied 2 to 4 inches above the site you're looking at, and then I'm going to palpate. So this is the median cubital that I'm palpating, and it looks like a good one, so I'm going to stick with that one. That is the first in which order you should draw blood depending on the veins. The next thing I'm going to do is prep the area in a circular motion. And after that, I'm going to go ahead and apply my gloves. These are non-sterile gloves, but you do want a pair of gloves that fit well, because if you have extra on the end of it, it will make it more difficult for you to be able to draw your blood. All right, now we're going to go ahead and set up our supplies, getting ready while this dries. It takes about a minute to dry, and so I'm putting my needle on my right side because I am right-handed. I'm putting an alcohol swab down, and then I'm putting the cotton ball. The alcohol swab is just to make sure that my cotton ball stays clean, and then I'm gonna grab my tube, and I'm putting one over there. The order is just for 1 tube. I have a backup just in case I need it. Now I'm going to reapply my tourniquet as the alcohol has dried, and I am ready to draw my blood. With this one, I have chosen to use a butterfly needle. And after you assess the veins, you'll determine which is best. There's a bumpy side to it, and so that's the way that your bevel, obviously your eye bevel should be up, and you squeeze those, and it helps navigate through. I went ahead and stuck it in. Once I feel like it's in, I'm going to grab my tube, and I'm going to place it. When you do this, you just want to make sure that you don't move the needle around because that makes it really painful. So that hand should never be moved. It should stay in that area. All right, we are placing the tube in and we have blood. That's a good sign. Since I only have 1 blood draw, my next step is going to go ahead and remove the tourniquet. After that, I'm going to remove the tube and grab my cotton ball. Then I'm going to remove the needle, activate the safety, and dispose of it in the sharps container. Then I'm going to ask my patient to go ahead and hold the cotton ball while I invert the tube. With a gold top tube, it is going to be 8 to 10 inversions. You never want to shake. It's just simply tilting back and forth 8 to 10 times for the gold top tube. Next, I'm going to go ahead and clean up my supplies while I'm waiting for her hand to draw. I will have her check a label with her name and date of birth, making sure that it is all correct before I place the label in front of her on the blood tube. Now I am applying the phlebotomy tape, and I'm going to make sure that's secure. After, if you noticed, I did look to make sure that it wasn't bleeding anymore. And now we have a happy patient that has her blood drawn. Thanks for watching.